Myalgic encephalomyelitis is a really tricky word to say, and it's even really trickier to live with. So my name's Nathan from Active Health Clinic, and today I'm going to talk about myalgic encephalomyelitis, or as it's commonly known, chronic fatigue syndrome. So to save my words, I'm just going to say ME/CFS as we move forward from here. So understanding this is really important, because if we can actually get a good idea of what it is, then that means that we can help ourselves as well as other people around us as well. So to be diagnosed with this condition, it's actually a diagnosis of exclusion. So what this means is that we don't know what's wrong with you, but something's not right. Now, at this point in time, I think it's actually really important to actually say that nobody wants to be unwell. Nobody chooses to be fatigued. And it's something that often it takes a long time for someone to be diagnosed. And when they are, it even can be a sense of relief. So as a diagnosis of exclusion, we need to rule out some nasty things. So this could be cancer. It also could be things like thyroid problems, low iron, or even celiac disease. So this is done through your GP or maybe your specialist as well. Now, once we've ruled out all those other conditions, then we need to be able to show some symptoms, and a range of these. Now, there's actually 4 different diagnostic criteria for ME/CFS. So there's the Oxford, Fukuda, Canadian, and ME/CFS primer. Now, some of these have their advantages over others. The Canadian criteria is probably the most thorough, but is a challenge to use in clinical settings for doctors. But generally these diagnoses is going to lead to you being in a position where that you have a group of symptoms which include post-exertional malaise. Now, this is actually the hallmark, the core thing. So post-exertional malaise means that you do something, whether it be physical or even mental, and then feel worse later on from that. So it could be straight away, it could be a couple of hours, but also could be the next day or even the day after. But that post-exertional malaise is a lot like jet lag, or just carrying an extra 30 kilos with you everywhere that you go. It's not something that you can just let go of. Now, in combination with that post-exertional malaise, or PEM, as it's sometimes known, is symptoms such as cognitive dysfunction, so poor concentration and short-term memory, as well as sore throats, tender glands, myalgia, which means aching muscles. It could be localized to, say, arms and legs, or it could be the whole body. Joint pain, so arthralgia, but then also other symptoms such as unrefreshing sleep, lightheadedness, sensitivity to light, noise, and realistically there's actually quite a few more. Depending on the criteria, if you meet 6 of those and you have the post-exertional malaise, then you'll be diagnosed with ME/CFS. Now, for adults, you need to have these symptoms for at least 6 months to be diagnosed. And for adolescents or people under the age of 18, it's 3 months. Now, as I mentioned before, when people are diagnosed, you may think that it's a terrible thing, but we actually look at it as an opportunity. It's a validation that you are not psychologically unwell, that you are not making this up, because ME/CFS is not a psychological condition. And that is super important, because no one chooses to feel unwell, and it's not just depression and it's not just anxiety. These are very significant conditions in themselves and shouldn't be trivialized, but it's not actually a cause or what ME/CFS actually is. So that's a bit of an understanding of diagnosis as well as symptoms. Now, I suppose the next thing is, what do we do from here? Because I think a lot of people actually are diagnosed, then go, well, that's it. And their GP will say, I don't know what to do next. Well, the first thing is to get a great team around you, and that is your GP, to make sure that you're supported and believed, and that it's something that they are there to help you and to guide you in this journey. It may be a referral to another specialist. It might be a rheumatologist to look for inflammatory conditions or management of pain through a pain specialist. But then there's also the allied health team. So this can range, and again, it depends on the person's needs, but it could be an exercise physiologist or a physio like myself. It could be a dietitian. It could be a psychologist, a social worker, an occupational therapist, and they will play all their different roles in the management of that. Now, we like to sort of talk about a person's temple, and this is really getting into what we actually do. And you're probably thinking, temple, ME/CFS, I don't get it. Well, it's an analogy in the sense that the first step for anyone is to pace their days. Now, pacing is not about how you walk and move, and often it's a misconception. Now, people who have been dealing with pacing for a while understand this, but if you talk to a relative or a friend, they might think you walk fine, and that's okay. But pacing is about balancing your energy throughout the day. So not doing too much in one block, and that could be over an hour or morning or even a day, that leads to that PEM or post-exertional malaise. So balancing your days and creating a foundation, so something really solid to grow from, is super important. Because if we don't have that foundation, then other things fall over. Like, how do we know our diet's the right amount? Or are we getting the right amount of sleep? Or with exercise? Or balancing our stress? So these are actually the next steps. So the 4 pillars, and I'll go through them one at a time, is finding the right amount of exercise. Now, exercise can have a bit of a history with ME/CFS, and it's not about just going and pushing. And in fact, it can't actually make you feel worse. It has to be sustainable, and it has to be sort of movement. So we actually are moving away from the word exercise, because I think it's not going to the gym. It's not just pushing through. Sustainable movement is something that we prefer to use, and this could just be getting up and sitting up in bed for those that are actually more disabled. It could be doing the dishes. It could be actually going for a walk. But the most important thing is that it cannot lead to you being limited later in your day, or cannot worsen your symptoms. You might feel it a little bit during, but it can't limit your ability to work, to play, to communicate, to even rest. So exercise is an important piece, but it's not just your simple go out, get fitter and stronger. Because to be honest, just saying that in itself is a little bit disrespectful, and saying that the person may just be lazy. But what we know that with sustainable movement, that if we can find that balance with pacing, then that allows other things to be a little bit easier in your day. Things don't take as much energy to do the same task. So if you're not sure of that, then don't do it. Speak up, and ask questions. If you're not confident with your practitioners, then ask, this is going to make me feel worse. Why should I do this? But always ask questions is really important. And if you find that you're not getting the results, then put your hand up. We're always happy to have a chat as well. Now, the next pillar is the management of sleep. Now, we all know sleep is unrefreshing. It's something that often people don't feel like they've slept, which is a very foreign concept for a lot of people. But for those that have ME/CFS, it's all too common. And unrefreshing sleep is often a consequence of the chronic stress on the body and a high wake drive, which we've talked about in other videos as well, which we can search through, the connection and the website. But it's something that we need to understand why it's happening, the rhythms and other things around that. Now, the next pillar is our diet. Now, there's not one size fits all. And I'd actually probably like to really stress this as we go through, that you just can't follow a script. You just can't say, I'm going to just make sure I take a break at 10:22 a.m. for 33 minutes of rest. It doesn't work that way. Life is different. ME/CFS is not linear. It's not 2 + 2 is 4. It's emergent. It's a lot of different factors coming into one. So when we talk about diet, it's about just healthy diets. And again, coming back to that person and their symptoms. So often we see a lot of people with nausea, which can be related to food, but sometimes it's not related to food, and it can be related to blood flow and other conditions like orthostatic intolerance and POTS. So finding the right amount of food, the right times, resting around food, and finding easy to prepare meals and things that don't take a lot of energy is super important as well. So that's why going into diet is something that we look at. Now, the final pillar is the management of emotional stress. Now, this is, as I mentioned before, not because this causes this illness, but it doesn't help it. And it takes a lot of energy that's unnecessary that I'd rather put to you and your ability to rest, or to talk with a friend. So understanding why we have that and the adrenaline that comes in our body, which again can also be related to OI and POTS and blood pressure management, is super, super important. So understanding our stress responses and managing that is something that we also look at. Now, every temple has a roof, or most do, I'm sure. I'm sure someone could tell me there's some that don't. But this roof is what we refer to as dim sims. And for those in Australia, that's not the late night snack that a lot of people have. And for those internationally, it's a parcel of food that we eat. But it's something that our body perceives our threat and safeties that can make things worse. And again, we talk about this in great depth in other videos, but we really want to make sure that we're surrounding our body with positive messages and positive vibes, I suppose, is some way of putting it, but not too much in an airy-fairy way, to really help our bodies not be triggered and to actually have a response, or have a positive response that comes with that. So this is really an introduction to what ME/CFS is, so myalgic encephalomyelitis, or chronic fatigue syndrome. So do practice it if you want. You can actually tag below and say how you say it or how you teach people to say it and things as well. But we want people to understand this, that you're not alone, that you're not crazy. We know that probably 1 in 200 people conservatively have this, and that's a lot. You know, we know that there's so many people out there that need to be recognized and to get care. So if you found this helpful, if you know someone that needs to see this message or hear this message, then please pass this on and help us continue to impact more people. Thank you.